Hello from London. This is the second plenary day of the European Conference on Education, Arts and Humanities in Gerontology. Next to me is standing Professor Gill Livingston. Thank you for being here. Could you briefly introduce yourself and tell us what you do?
My name's Gill Livingston, as you said, and I work at University College London and in a local health service trust. I do research mainly in dementia, and I'm also a clinical psychiatrist.
And you gave a keynote presentation today. Could you tell us what it was about?
It was about preventing dementia, about the remarkable idea that if you can prevent 14 risks, which I talked about, you could possibly prevent 45% of all dementias.
You spoke a little bit about this in your presentation, but what role do education in the arts and humanities play in helping reduce dementia?
Well, I think it's education in general, so it doesn't really matter hugely what we think about, but thinking is really important, and thinking in a varied way. And obviously the art humanities are very, very interesting, and therefore things that people engage in and do things. So both as a child and as a young adult, but actually throughout life, keeping cognitively stimulated is very important for your brain.
You showed a lot of data and a lot of research that has come out of the Lancet Commission. How does that translate to policy?
I think it's very varied in different countries, to be honest. But for example, in Britain, it's informed policy on cigarette smoking to try and increase the age at which people smoke cigarettes, which means many people never start. So it's part of the whole story. It's also, we have midlife checks, and we now look at dementia risk factors and explain how people might reduce the risk of dementia. In the States, there are now targets to try and change things through policy and decrease the risk of dementia. So it's very different in different places, but there are a lot of countries in the world which are implementing part of its policy.
Do you see that happening easily in the UK, where your research can be transmitted to the policymakers?
I think many policymakers know about it. I mean, I think nothing is easy, but the government use our figures and it informs their policy and changes what happens. So it certainly, I think, has helped and been influential. I mean, I talked about a bit in this that in primary schools now, children are not allowed to head balls, and if they're playing football and they do that, then the game stops, and it's an infringement of the rules. These things are, to me, quite amazing, that these children will never know, really, that this is part of a policy to help reduce dementia, but the policy has been put in place and changes people's lives.
Now, what do you think about disruptive technologies and artificial intelligence? In our March conference, we had a panel that was discussing how AI is contributing to cognitive deterioration. What are your thoughts on that?
Do they have any evidence?
No.
Yeah, that's what I thought. So, I mean, humans like tools. AI is obviously going to change many, many things in the future. And it's important, very important, that we try to use it as a force for good, and not as a force for harm. I suppose it's like everything else, but it's not going to go away.
Well, thank you so much for being here. It was very insightful what you presented today, and we hope to see you again soon.
Okay, well, thank you for inviting me.